Good evening. You are joining us live on Facebook for this month's episode of Science Stream, which is brought to you by Greatech. Welcome. We'll be starting our podcast in a bit. Meanwhile, please make yourself comfortable. If you have any questions for our guests, please leave them in the comment section. See you shortly. Hello once again, especially to those who have just joined us. I'm Sean from Penang, Penang's very own Science Discovery Center. Nuclear medicine is a specialized area of radiology that is used in diagnosing bodily functions and treating certain diseases, including cancers. While nuclear medicine is a medical specialty that has been around for decades, yet when people hear the term nuclear medicine, many may not know what it actually is, and some may even bring up the question about how safe it is to incorporate radiation into the treatment of illnesses. In conjunction with World Cancer Day, Dr. Alex Khoo Cheen Hoe, a consultant nuclear medicine physician with Penang Adventist Hospital, will share with us more about nuclear medicine in this episode of Science Stream, which is brought to you by Greatech. Dr. Alex obtained his Bachelor of Medicine and Bachelor of Surgery from the University of Malaya in 2005. He completed his internship at the Queen Elizabeth Hospital, Sabah, and continued to serve in Sabah until 2010. He received his postgraduate training in nuclear medicine from the University of Science Malaysia and became a Fellow of the Asian Nuclear Medicine Board in 2016. Prior to joining Penang Adventist Hospital, he was the head of Sarawak General Hospital Nuclear Medicine Department. He served as a clinical supervisor to postgraduate students in the field of nuclear medicine when he was a nuclear medicine physician in Penang General Hospital before his transfer to Sarawak. He has given various presentations at the state and national levels. In recognition of his work, the Ministry of Health Malaysia presented him with the Excellent Services Award in 2008 and 2015. Dr. Khoo's expertise in nuclear medicine includes both the diagnostic and therapeutic areas. The diagnostic areas include PET-CT, planar, and SPECT-CT scans for bone, renal, cardiac, endocrine-related, brain, and lymphatics, among many others. Though he has special interest in the treatment of differentiated thyroid cancers, he's also able to treat various other diseases, including hyperthyroidism using radioactive iodine, hepatoma using selective internal radiation therapy, and hematosis using radiosynovectomy. He constantly keeps abreast of the latest developments in the field of nuclear medicine by attending training courses held both at the local and international levels. Apart from having authored several publications in peer-reviewed journals, Dr. Khoo also actively participates in research activities. Presently, Dr. Khoo is a member of various professional organizations, including the Malaysian Society of Nuclear Medicine and Molecular Imaging, Malaysian Oncology Society, College of Radiology, the World Association of Radiopharmaceutical and Molecular Therapy, and the American Society of Nuclear Cardiology. Without further ado, please join me to welcome Dr. Alex to the show.
Hi, thank you, Sean. Good evening.
Hi, welcome to Science Stream, Dr. Alex. Thank you for being with us tonight.
Thank you, Tech Dome, for the invitation, and good evening to everyone. I'm Dr. Alex Khoo Cheen Hoe. So,
before we start, we would like to remind the audience first to share this Facebook post, right, to stand a chance of winning a Penang Adventist Hospital woven bag. Okay, so this Penang Hospital woven bag. Penang Adventist Hospital umbrella. This is a big umbrella, it's a golf umbrella, and an Adventist bakery voucher, right? and also a Tech Dome Penang entrance ticket. Okay, the entrance ticket to Tech Dome Penang is valid until the end of the year, so you don't need to worry that it's still MCO period. The 10 lucky winners will be selected from those who have shared this post as well as answered the questionnaire at the end of tonight's episode. All right. We would also like to thank our sponsor Greatech for making this episode possible. So, Dr. Alex, I'm sure you would be interested to know how much our audience knows about nuclear medicine, right?
Yes.
So we will be conducting some polls tonight, and the first poll we have tonight is, what do you think about when you hear the word nuclear? Okay, so what do you think about when you hear the word nuclear? A bomb. B, an atom. C, a clear space. D, electricity. Okay, so choose one of the answers by clicking on the poll answer button below. Don't worry, as no one will be able to see what you've chosen, not even Dr. Alex, not even me. All right, Dr. Alex, I'm not sure if this is a sensitive topic for you and Penang Adventist Hospital, but could you relate to us how it was like when a patient at Penang Adventist Hospital was found to be COVID-19 positive back in August last year?
Oh, okay. Frankly speaking, we were caught off guarded. That there was actually a patient, but thankfully our nursing team and also the doctors were very cautious. They actually practiced all the proper precautions, and we managed to actually to confine the disease to the patient, and none of our staff actually were infected with COVID-19, which is actually very good, in my opinion.
Yeah. I think it was a very worrying situation at that time because Penang was a green state for a very long time already, and then suddenly I believe there were a lot of people afraid, and I think politicals also became very quiet.
I suppose that's true, but things happen, so we cannot avoid. It can happen to anyone, but thankfully, our hospital, we practiced the utmost precautions, and we managed to overcome this. Yeah, we did very well in this, I suppose.
Yeah. I think there's some misconception as well because I would think after you all have done the disinfection,
Yeah.
it would probably be one of the safest places to go right after you have done the disinfection. But there were still people afraid of going. So I think there's this probably they don't really understand well the situation of or how the virus actually requires a host for it to pass on to or infect others.
Yes, I will agree with you. Actually, the most worrying thing is actually fear. People fear more than they know. So with knowledge, I think the fear will dissipate. So it is important to have equip yourself with the knowledge of how things are going around COVID-19. Especially sometimes people just read headlines without knowing what's happening. For example, recently we were saying that private hospitals are ready to take in COVID patients, but that does not mean that we are already having COVID patients. But many of them were thinking that we are already having COVID patients. No, we are just saying that we are working together with the government, willing to take in case that if the government hospitals are overwhelmed.
Yep. Okay. So thank you very much for enlightening us on the situation then. Let's see the poll results. Right? First poll results. Okay. 57% says it's an atom.
Okay.
57% says it's an atom. Right. So Dr. Alex, would you like to elaborate?
Sure.
Some things I would
Let me
say
go
as a
through the
bomb as
slides.
well.
Yeah, sure. What about let us
Alright.
go through my presentation and I'll
Okay.
elaborate.
Yes, you can begin.
So what is nuclear? I think that was the first question. What is nuclear? The first thing on people's mind will be the nuclear bomb in Nagasaki and Hiroshima. You can see the atomic bomb there is a fat boy, and you can also some people also relate nuclear to the nuclear power plant disasters in Chernobyl in 1986 and also Fukushima. So what is actually nuclear? Nuclear is actually the thing that we have inside our atom, which is actually the nucleus, which comprise of proton and neutron. So what is actually radioactive? People talk about nuclear and they talk about radioactivity. So let me allow me some time to tell you about this state of radioactivity. It is basically talking about an atom which is unstable. Previous slide, please. A state of atom which is unstable. They can be either too heavy, where they have example, it's a patient who is very heavy, obese patient, they want to lose weight. So if an atom, unstable atom is very heavy, like uranium 235, so what they will do is actually they will try to excrete their to let go of their mass. So in other words, also you have children who are very active, we have atoms who are very active, like a hyperactive child will be running around. So they release their energy, then they go to a steady state, then they rest. So where else? Another one is, I used to tell my patients, if you're in a family of a husband and wife, and the husband brings back a girlfriend, the wife will try to kick the girlfriend out. So in similar, sometimes when you have too many protons in the nucleus, you'll try to kick it out. If the wife brings back a boyfriend, the husband will try to kick it out. So in other words, if there's too much neutron in the nucleus, then there will be an activity where we try to kick it out. Okay, so this is how radioactive, in other words. Okay, next please. In the next slide, so people don't understand about radiation. Radiation is actually everywhere, and I think you have heard about radiation in our cosmic, if you're flying around, you have in our bodies. And for those who like bananas do have radioactive. And mind you, you don't have to worry about having bananas, because bananas itself are safe to eat. Okay, what about background? If you look at this data here in 1997 to 2007, you see that background radiation is actually about 2.4 millisieverts. And out of that, the medical that is the radiation received by people under receiving medical care is only 0.61. And in nuclear power plants, you can see it's very, very low. Even for those who are working in this radioactive environment, you can see it's very, very low too. So in the next slide, we'll talk about hotspots around the world. As you know, some countries around the world have higher radiations, such as the one in Iran, Brazil, Australia, Kolam in India, and also in China. So you can see the lady there on the beach. It's actually there's some radioactive, but it's not harmful. Okay, so a lot of people have this fear. They say, "Oh, it's radioactive. What about Linas and so on?" Look about this Ramsar, Iran. Yeah, so they are very high radiations, but if you can see, they have mentioned that certain areas with high radiation do not actually have higher risk of cancer compared to us. And in the next slide, we'll talk about the relative risk of cancer occurrence. As you can see, those who don't like to eat vegetables or those who like to smoke, you actually have higher cancer risk compared to those who are exposed to high radiation, which is 100 millisievert. Okay, this is 1.05 as compared to if you don't eat vegetables, it's 1.06. All right, as we go on to the next slide. What about nuclear medicine? Nuclear medicine is actually a branch of medicine where we have imaging. We can actually image things, and also we can treat. And we can treat various cancers and also non-cancer related. And this is a term that I would like to introduce to you, theranostic. Theranostic is a very unique term for us, whereby we can image and treat patient at the same time. Unlike many other modalities, if you just do imaging, you just do imaging, or if you do treatment, you just do treatment. But ours, we can do two things at once. Okay, so with the radioactive that we have, we can actually treat and visualize where the lesions are. So I like to highlight this term called precision medicine. In precision medicine, if you can see, this is an article written in Nature in 2015. Talking about the drugs that we commonly use, and we thought that is effective for us. If you can see, one of the common one, which is Crestor, is a statin, which is used for patients with high cholesterol. And you can see only 1 out of 20 actually benefits from this treatment. Imagine how much money we spend on treatment, and only 1 out of 20 actually benefits. And for other type of cholesterol, 1 in 50. So as in precision medicine, now we come to precision medicine. Why? As I think everyone can remember, Barack Obama, the former US president, he has this, he launched this precision medicine initiative in 2015. And he said that doctors have always recognized that every patient is unique, and doctors have always tried to tailor their treatments as best as they can to individuals. If you can match a blood transfusion to a blood type, that was an important discovery. What if matching a cancer cure to our genetic code was just as easy, just as standard? Okay, so this is why we are talking about precision medicine. Next slide, please. So what is our future? So in the past, we were talking about one-size-fits-all medicine. So I think many of us, when we had our grandmothers taking care of us when we were having cough and cold, they will say, okay, you take this medicine, whether it's a fever due to virus or bacteria, everything will be the same. Now, we have stratified medicine, and now we're going on to precision medicine. Okay, stratified medicine is whereby we actually see that, okay, certain groups of people, like for example, high blood pressure medications are not suitable for certain group of people, and certain group will benefit. And now we go on to precision medicine, where we actually look at the genetics of the molecular parts of the patient, and then we decide which one will work for them. All right. So what are the clinical applications in nuclear medicine? Basically, we have 3 main parts. We have the imaging therapy, and also we have some laboratory-based tests. Next. So we're talking about the concepts and the utility of these various imaging. So I'm not sure if many of you have seen this. This is Waldo. It's a cartoon. If you go to any bookshop, and you can find this cartoon. So the thing is, we like to play this game where we need to find Waldo. Where's Waldo in this picture? Similarly, if you do a CT scan, so where's the lesion? So sometimes we wouldn't know where's the lesion, and we can find a lesion, but we are not sure what is the actual problem. So you can go to the, and so when we inject radioactive, you can see Waldo is in the picture in that location. And on the CT scan, in the PET, you can see actually there's a lesion over there on the right side of the screen. So when you do a fusion image, you can see Waldo is situated next to the Punjabi guy. And you see in our fused PET CT, you can see actually is on the right side, which is in this case. Okay, you can see the lesion very well, which is highlighted in red. Okay, so now you know that we need PET. So the clinician will one thing say, I need a pet. So which pet do you want? Is it a dog, cat? So you can see that there's actually many radio tracers which can use in our case here, which you can see we have FDG, FET, choline, and gallium CTA, citrate, and so on. So these are many tracers that we can use. So what are the indications of PET CT imaging? So we have cancer-related and non-cancer-related, and it actually can cover a lot of things, from the brain right down to the skin and various organs. And for non-cancer-related, which I'll show later, some examples, we can actually see for patients with fever of unknown origin, and to guide biopsies, and you can even visualize the heart functions, and also to do some dementia studies. Okay. So I'll bring you to some examples of PET CT. So in a staging of lymphoma, where there's actually a proliferation of the lymph nodes, in this case, there's a 35-year-old man with classical Hodgkin lymphoma. You can see in this CT scan, we actually stage it as stage 2. But when we do a PET CT, the patient is staged as stage 4, because lesions that was not seen in the CT scan is actually now well seen on the PET. As you can see here, it's in the bone marrow. Okay, in the bones. In the next slide, you'll see that PET CT is also very useful in upstaging of disease. As you can see, a young man in his late 30s, he had epithelioid angiosarcoma, and he had a good resection margin surgery. But when he did the staging, he found that there was actually a hypodense lesion in the liver there, and there's a surprise when he did a PET CT, and you can see the PET CT images. you can see that the PET-CT images showed the lesions everywhere in the body, which is saying that it was more than what the clinicians initially assumed it was. Okay, next slide. So for melanoma, a middle-aged lady with cutaneous melanoma near the scapula, she had resection, and then subsequently she was found to have a bowel mass, and it was turned out to be a metastatic bowel melanoma. And when she did a PET, NUSC found that the cancer actually had spread all over, not just to the bowel, but elsewhere. And surprisingly, the patient did not know that she had such severe disease. Even the doctors were surprised. Okay. In case of tumor recurrences, so in this patient, he had a treatment for nasopharyngeal carcinoma, and there was actually a metastasis to the brain. You can see the lesions shown by the arrow on the CT scan on the left A. You can see that there was actually a lesion there which was suspicious of recurrence. So when you do a PET and there's no uptake, where you can see there's no coloring, then you know that there's actually no tissue, no viable tissue in the area. So this is actually a dead tissue, so it's not a recurrence. Next. So we also can use PET-CT for downstaging of the cancers. As you can see here, we have a CT scan of the lung. You can see a mediastinal lung nodule, and after treatment, the lung nodule was still there. So for doctors who treat, then they will get worried. But if you do a PET, you can see before the treatment in A, as you can see, there's uptake in the mediastinal nodes, but none in the lung. And subsequently, after treatment, there was none in the lung. So basically, this was not actually, the lung lesion was not due to lymphoma. So it was due to something else. So this treatment was downstage rather than upstage. Okay. So in terms of patients who have treatment, like in this case, before treatment, you can see the one highlighted by the arrow on the left nasopharyngeal region. So you can see there's an arrow, and after treatment, you can see that the color is no longer there, suggesting that there was actually improvement in after treatment, although the mass was still seen, but actually the tissues are actually dead. So you have also patients, when we do, in this example that we have, a patient who had treatment for nasopharyngeal carcinoma. He was complaining of pain everywhere, did a CT scan, and there was nothing in the bones. So 2 months later, he came back with some suspicious lesion in the pelvic bone. But when we did a bone scan, you can see the bone scan images. You can see actually the tumor was everywhere in the bone, which means that we detected the lesions much earlier compared to the conventional imaging. So what about PET-CT in biopsies? So you can see in this lady here, you can see that there was a mass in the mediastinal region. So it's a huge mass, and the most important thing is actually to get a biopsy. So where to get a biopsy from? So by doing a PET-CT, we can actually get an idea where the lesion is. So if you actually biopsy from the longer arrow in a picture E, you can see the picture E there. Picture E, the longer arrow. If the doctor had biopsy from that area, then it will be biopsying necrotic area, meaning to say after the biopsy results come back, it will most likely be negative. So if you have biopsy from the shorter arrow, the area of the shorter arrow, then it will show that actually there was a lesion. So it's important for PET sometimes to guide. So the next slide will actually show you examples of cases similar cases, where in this case, a patient in his late 60s, a smoker, and another non-smoker. You can see 2 large lesions in the lung. And you can see if you biopsy the sites, where the biopsy sites were all negative, meaning to say that there was dead tumors in that area of the biopsy. So by doing a biopsy on those sites, the yield will be probably poor yield, and you probably wouldn't get what you want the answer. So by knowing where to biopsy is important. Okay, the next slide, please. So it's also important that we evaluate treatment because some treatments are very expensive. For example, in this case, it's a GIST tumor. GIST tumor, normally we will have to wait about 3 months. But in this case, if you wait 1 month, you can do a CT scan again, and you see the difference. You can see that the lesion has shrunk. But mind you, the treatment is not cheap. It's about more than 10,000 a month. So imagine if you don't, your treatment is not effective, then you'll be thinking of wasting a lot of money. But if you do a PET, can you see the PET? Yes, you can see the PET. You can see that the dark images, the dark colors are the sites of the tumor. And after treatment, the sites are no longer dark, meaning to say that the tumor is actually dead. No more the tumor, the treatment has actually kill off the tumors. And whatever you see is actually dead tissues, which will take time to disappear. So sometimes we also use, it's very important for us to see the response of treatment. But in this case, a patient with a diffuse large B-cell lymphoma, you can see such a huge lesion in the mediastinum, but upon treatment, you can see it's clear. So even if you do a CT scan, you probably see some lesions there, but you will not be able to tell whether these lesions are due to residual disease or not. But with PET alone, you know that those tissues are actually dead tissues. You can also see patients who, over the period of treatment, in this case is in November 2017, you can see a lesion in the chest. It progressed in 2018 to have all the dark spots in the mediastinum in the chest area. And then upon treatment change, you can see actually none left. Okay, so this shows that how we can actually monitor and treat patient as fast as we can to avoid delay of treatment. So in this case, a patient with cervical cancer, if you look at a bone scan, a CT scan, it's a bone window in a CT scan, you cannot find any lesion as shown in the arrow, but when you do a PET, there's actually a lesion in the bone. So this means that there was actually the metastatic disease. It was picked up much earlier. So we basically upstage the patient rather than downstage or, okay. The next slide will show you a question that we always have this problem among doctors, whether it's benign or malignant. So we have a lung lesion here. You can see on the left lung, you can see the lesion there. So in left on the right hand side. Okay, so you can see it's actually up to 40% of the malignant tumors are inaccurately classified as benign based on the radiological features. But with PET, we know more or less that these lesions are actually benign or malignant. So the features in PET actually will suggest also. All right. The next slide, please. So in radiotherapy planning, you can see the lesion is highlighted by the arrows. The arrows shows that there's a collapse and probably a mass there. You're not sure which one is the mass, which one is the collapsed lung. So with PET CT, you can see actually the lung mass is actually the cancer is over the one highlighted by the arrow, whereas the rest are actually lung collapse. So you can just radiate the one that is highlighted by the arrow. So in patients with unsuspected metastasis in esophageal cancer, this patient after treatment, you don't see any lesions. So we do a PET CT. You can see actually there was lesions elsewhere, which was not seen on the conventional imaging, which means to say that PET is actually a very sensitive tool to detect all these metastases. Next. Sometimes in rectal cancer management, we actually have this, we do follow up patients with tumor markers, which is the CEA, as you can see there. This CEA was within normal limits, but on CT scan, there were some suspicious lesions on the scan, but when we did a PET, those suspicious lesions were not benign. They were actually true recurrences. Okay, they were malignant pelvic implants. Next. So sometimes we also see like patients when we follow them up after treatment, you can see in this case, breast cancer, you can see after treatment it's cleared. Whereas for the other next slide, when we see the next patient, she had nodal involvement in the right breast, and then upon treatment, you can see in the CT scan, didn't have anything on the bone, but on the liver, you can see the liver, this nothing on the CT scan, but on the PET there was something. And when we did the whole body, you can see the next slide, you can see that there was cancer everywhere. It has spread very fast, although the CT scan did not pick it up. Okay. Next. So in a patient with prostate cancers, sometimes we have a low Gleason score, 2+2, but then the PSA is high. PSA is a tumor marker. So tumor marker is high. Then sometimes the doctor will be wondering, the tumor grade is not so high, but then the blood tumor markers are very high. So is it spurious? Is it problem? Is a problem to the patient? Patient say no problem, no bone pain. But when you did a bone scan, patient had metastatic disease everywhere in the bone. Okay. So sometimes we will be wondering which is better. In the prostate cancer, is you doing the FDG PET or is it the sodium fluoride PET? So depending on the type of cancers, we need to choose which PET CTs are suitable for. In this case, it's more suitable to do a bone scan, which is a sodium fluoride PET compared to the FDG PET. All right, next. And you can see neuroendocrine tumor imaging. You can see this is FDG PET on B, and then this is a gallium dotatate. You can see in the B imaging, we can't see any lesions in the brain and in the chest. And in the gallium scan, it was better seen in the brain region and also in the mediastinum. Next slide. So in the gallium prostate cancer, which is used for we use PSMA for prostate cancer, you can see actually it helps to localize the disease. Rather than subjecting patients to chemotherapy, we actually can just give them radiotherapy and just targeted, so the patient do not have to undergo more systemic disease, treatment. Next. So I did mention just a while ago that we talk about use of nuclear medicine for cancer, but we also can use it for non-cancer purposes, such as this. When a patient comes in with fever, unknown fever everywhere, so you can see that all the blood tests were all normal, but when we did a PET CT, we found actually most of it was in the muscles. And when we did a biopsy of the muscle showed that he actually had polymyositis, and the treatment was just steroids. Rather than, you do all the wild goose chase, you do all the tests and still negative. When you did a PET, we could identify, and we did a biopsy directly, and you can find where's the lesion. Okay. So now I'll come to the next imaging using SPECT-CT. So these are using different radio tracers. So different radio tracers need different imaging tools. So SPECT-CT is another imaging tool whereby we can also see various things that the indications can for diagnostic. We can actually scan the patients and look at the lesions, and also for therapy purposes. Okay. So I'll just run through some examples of SPECT-CT cases. So like this is an example of a bone scan. We can see the lesion in the leg, which is on the left leg. And incidentally, we found a lung lesion. We can see better. Can you see on the lung lesion? Okay, this also we can also see the next one. We can see the heart. We can actually visualize the heart. So what a lot of times people say, I can do CT scan, I can do angiogram, I can do MRI, why do I still need myocardial perfusion? Well, myocardial perfusion scintigraphy do not affect the kidneys. So it's relatively safe for the kidneys. So most patients who have heart diseases, normally their kidneys are also affected. So by doing our scan, we are able to see their heart function without actually disrupting their renal function. Okay. So this is another one where we can, the earlier scan we showed about the heart muscle. This one is we are able to show how much output from the heart, meaning we are able to see how much the cardiac output. So doing different scans can help us tell the clinicians what is the function of the heart. Next one, please. Renal scan, sometimes we have cases where patients come in with pain in the back loin, and then they are having tests, everything normal, x-ray normal. And when we do a renal scintigraphy, and we can see, actually, you can see the kidneys. This is actually imaging from the back. So you can see the R means the right side and the left side. So you can see the dark spots on the left side, but not on the right side. So from the front, number one, until to the end. Okay, so you can see actually, initially you don't see on the right side, and then at the end, you can see on both kidneys. So if you look at it at images serially, and you notice that actually something is wrong with the right kidney. Okay, so this will tell the doctor there's something wrong. Okay, so in parathyroid imaging, we actually have patients who come in with hypercalcemia, where they have abnormality of the parathyroid gland, and the doctors cannot find where's the lesion. And doing ultrasound and all the imaging, they cannot find, but they use our parathyroid scan, they can find actually is in the chest, okay, in the mediastinum. So the doctor can actually easily go in and remove it. So this is one of ways that we can actually help the doctors to identify the locations. Okay. So in Meckel's diverticulum is actually for patients with bleeding, especially children. They come in with bleeding, they cannot find where's the site. This one will help them to identify the sites. The next one, we will see HIDA scan. HIDA scan, we were talking about the liver function. We will be able to tell whether the liver is functioning or not. Like in patients with biliary atresia, babies, they need urgent operation. So by doing this scan, we are able to determine whether actually they have this biliary atresia or not. And the early detection can actually help the patient better survival. Okay. So in patients with GI bleeding, gastrointestinal bleeding, they have bleeding from the abdomen, and the doctors cannot find where's the site. No matter whatever they do, they still cannot find. So one of the ways is we actually help them to identify the site. So in this image, you can actually decide where's the location, and the doctor can go in and do the surgery to minimize the bleeding. So we can also help in breast cancer surgery, where we try to preserve as much lymphatics, because lymphatics, some patients after going through lymphatic surgery for the axilla, what will happen is they tend to have a lymphedema. By doing this sentinel node, we actually choose which node we need to remove. If it's not involved, then we don't need to remove. If it's involved, then by the cancer, then we have to remove. So this one will help the doctor identify which of these lymph nodes are to be resected. Okay. Yeah, they also can do to lung ventilation perfusion for patients with pulmonary embolism, and also patients with to see whether the suitability for surgeries. Okay. Next. So in therapy, there's a lot of things that we can do with therapy. Let us go through the most basic one. Patients with hyperthyroidism, you can see this patient with the starry eyes, and after treatment, you can see the eyes. Okay, and for those patients with very large goiter is the swelling in the neck, you can see actually after treatment, the qing has reduced, and it's as simple as just either you ingest or swallowing the capsule. Okay, the iodine 131. So if you go by conventional treatment with carbimazole, you have this what you call share market like condition where you have ups and downs. So by our treatment, we actually just render the patient, we don't have to go through all these ups and downs, okay? So we also treat patients with thyroid cancers using this iodine, which is actually the gold standard. Okay, we can actually see in this, as I mentioned, treatment and visualization in the same goal. We can see actually this treatment of iodine, we can actually see the lesion in the lung and also in the bone. For patients with hemarthrosis or rheumatoid knee arthritis, you can see the swollen leg. And what we do is actually we do radiosynovectomy, where we inject radioactive into the knee joints or any other joints to kill off the synovium, and to hope that the new synovium that grows will not have this problem. Okay, it's actually very effective. So we also have treatment for hepatocellular carcinoma, which is a liver cancer. You can actually do by embolizing, putting the radioactive into the sites of tumor, and this is actually very good because it has less side effects for patients. Okay. And for patients with bone pain, when they have cancers, you can see there's a lesion at the back there. Okay, as seen by the yellow. For these lesions, you can do radiotherapy, but the patients with all those sites you can see everywhere in the body, how are you going to radiotherapy the whole body? So you can't. So what we can do is actually we can give some radioactive actually to target the bone sites, and actually it's quite effective, and it actually improves survival by 30 over weeks. Okay, response rate almost 80%. And so what do you know about these two personalities? So this is Steve Jobs, I guess. Can you know Sister and Patrick Swayze in the Ghost movie? And what do they have in common? They actually died of pancreatic cancer. And Steve Jobs died of islet cell neuroendocrine tumor, and Patrick Swayze died of intraductal papillary mucinous pancreatic cancer. Okay, it's important to know the type of cancer is because if you went through Steve Jobs' history, he actually lived quite a long time with the cancer, whereas Patrick Swayze died after 2 years. So you can see that certain tumors like this, like neuroendocrine, is in the next slide. I'll show you. You can see, like, for neuroendocrine tumors, you can see how bad all the dark spots there, and with treatment, you can see that the patient actually recovered. So Steve Jobs actually had this neuroendocrine tumor, and probably he did not go through the treatment much. If he had gone through the treatment earlier, probably he would have could have been alive now. All right. So neuroendocrine treatment previously cannot treat, now you can treat. And for PSMA therapy, which is for prostate cancer, you can see all the red spots. The one beside is after treatment. So before treatment, you can see it's everywhere. And after treatment, the one beside you can see is quite clear. So this PSMA therapy is actually quite effective for patients with prostate cancers. Okay. And I'd like to end my presentation today by a quote from Marie Curie. Nothing in life is to be feared, it is only to be understood. Now it's time to understand more so that we may fear less. So it's actually fear is the one that is causing a lot of problems to us. So if we know more about whatever we are dealing with, then we fear less. Okay, thank you. For more questions, you can, if you have questions and you would like to find out more, you can actually read some of my articles that I've written. You can go through. If you have more, you can email me at my email, alexkhoo@ph.com.my. Right. Okay, thank you.
Okay, thank you very much, Dr. Alex, for that informative sharing. Okay. So, I agree with you. A lot of people fear, a lot of people worry when it comes to all this radiation. Right? But it looks like it does have its benefits as well, as you have clearly shown when it's compared to biopsies. Okay. So nuclear medicine is really useful. That covers not only diagnosis but also treatment. So to those who have just joined us, we had Dr. Alex from Penang Adventist Hospital with us on tonight's episode of Science Stream, which is brought to you by Greatech. All right. Let's have a poll. Okay, let's have a poll before we address some questions. We already have questions, but let's have a poll. Our second poll. Do you think that you are being exposed to any form of radiation right now? Okay, so you can just let us know what you think. Okay, you know what to do. Click on the poll answer button below. Don't worry that you get it right or wrong. Okay, we just want to gauge how much you understand. Right. Okay, so we have one question here. Okay, we have the question. Okay, would radiotherapy affect the surrounding healthy cells?
Radiotherapy and nuclear medicine is a bit different. So radiotherapy is actually using an external beam to actually to radiate the area. Whereas in nuclear medicine, we are actually either injecting or ingesting the radioactive inside the body. But anyway, just to answer the question, depending on the site, with newer machines, radiotherapy machines, we actually can target very well. In nuclear medicine, we are actually using radio tracers, which are quite specific. It's so targeted like a missile. So radiotherapy, and just to clarify, radiotherapy is actually more for the clinical oncologists or the radiation oncologists, whereas for us, nuclear medicine, we actually have targeted. So whatever that we use actually is targeted. You go to where the specific site we want. So the healthy tissues are less affected by the radioactives.
Okay, so how long will the radio tracer and hence the radioactivity stay in the body after the procedure?
Okay, depending on the type of radio tracers that we are using, like for example, in FTG, we use for PET-CT. Actually, the half-life is actually 110 minutes. So by 20 hours, it should be totally washed out from the body. But because humans, we drink a lot of water, it tends to flush out even faster than that. Okay, the physical half-life is 110 minutes, so it is actually very fast.
Okay, we do have the results from the poll just now already. Okay, so it looks like they've been paying attention to your to you just now. All of them answered that yes, they are being exposed to a form of radiation right now.
Yeah, the term radiation, you have to be quite clear. Radiation does not mean that radiation from radioactive alone. Just for example, have you seen your car radiator?
Mm.
Car radiator
Yep,
is
yep, yep.
actually, the term radiation is actually the transfer of energy. So the term radiation is a transfer of energy. So in radiator, in the car radiator is a transfer of heat, which is also a form of energy. So in nuclear medicine or in any other treatment, radiation just means that, I mean, everyone takes it, radiation is something related to radioactive. Fine. So basically radioactive is everywhere in our world. So there's even cosmic radiation. You go flying everywhere, you still be exposed to it. So the thing is depending on the degree of exposure.
Okay. So before we address more questions from the audience, we
Yeah.
shall have our next poll. Okay. This is actually our last poll for tonight lah. We have only 3 today. Have you ever undergone the nuclear medicine imaging procedure? Okay, so you've heard about what are those. So have you done one? Okay, so click yes or no below if you have undergone nuclear medicine imaging procedure before. Okay, so let's now have the next question from the audience. All right. So Melissa Kwan asks, is there a limit in the number of PET scan that a person can have in terms of radiation in the body?
Okay, we doctors do not subject patients to PET scan all the time. Okay, so depending on the situation, uh, it's actually quite safe. We normally do it like as a baseline before treatment, and then after treatment or in interim, and at the end of treatment or evaluation. So we don't do it so regularly. So patients sometimes the fear they said, oh, you have to do it so often, but it's not true. Uh, like for example, in the cases of lymphoma, we actually do it as a baseline. We can do it interim and at the end of treatment. The reason why we do it is actually we want to know whether it's effective or not. If the treatment is not effective, then we need to change the treatment. All right. So the fear of undergoing PET is unfounded, I guess. Doctors will not simply ask you to go through all these tests. Yeah.
Okay. We have also another question.
Yeah.
Okay. So some comments, very good insight into nuclear medicine. The question is how cost effective it is for treatment using radioactive sources compared to conventional surgical therapy. So I wanted to ask that question. So the cost. If I've missed something earlier, can I know what's the mechanism of prostate cancer nuclear medical treatment?
Okay. Again, we have to go through the. You have to go back to the guidelines. The guidelines recommend the treatment of using, like for example, in prostate cancers, it's only meant for those who have metastatic castrate-resistant prostate cancers. So it means you have undergone through all the initial treatment and you failed, then only you go through our treatment. All right. So, but things are very fluid, so it can change dynamic. So you can change, the guidelines can change, but at the moment now we still go back to fall back to the guidelines. The guideline says that you should undergo the initial treatment first before you proceed to ours. Yeah.
I think you mentioned about cost as well. How cost effective
Okay, the cost
compared to
is actually
conventional surgical therapy?
okay. Depending on the upfront cost, sometimes patients they said, "Oh, it's very expensive." Yes, it's just like you consider like spending 10,000 a month over a period of 2 years, which is around 240,000, correct? 120,000 a month, a year, in 2 years, 240,000, or coughing out 100,000 in a year and treated, and you're cured. So sometimes nuclear medicine therapy can be a bit expensive upfront, meaning you have to pay up probably 100,000 at one go. But if it's effective, then you don't have to go for a longer period. Whereas if you see for other treatments, probably you have to go for a longer period and still may not cure the disease. Yeah. So again, it's quite a difficult question to answer because you need to know what disease are we dealing with.
Okay, we have another question from Daniel Low. Daniel asks, are we safe to be around other people after going through a nuclear medicine test?
Uh, Again, I have to be quite clear, depending on the type of test that we undergo. So some tests, like we normally tell people uh, to keep a distance from the children and pregnant women for a certain period of time. For example, like in the FDG PET-CT, within 24 hours, okay? But in other scans, you must understand that whether it's for therapy, for imaging, and so on. So most of the time for those imaging ones, it's quite safe, yeah, because there's excretion from the body and it's quite safe. For example, for the dynamic renal scan, immediately after you finish the scan, almost all the radioactive are out of the body. So which is actually quite safe. So the fear of people saying, "Oh, I'm still radioactive, I'm being mutant," no, it's not true. Yeah.
Okay, before we address more questions, let's look at the results of the poll just now. Okay, so majority have not gone through nuclear medicine imaging procedure yet. Only a quarter has done so. So a lot of opportunities. I mean, hopefully they don't need it, but then if so, then yeah, they can probably opt for this now that they know the effectiveness of this and the benefits that it brings. Okay, we have a follow-up question from Melissa. Okay, so Melissa's follow-up question: can the radio tracer be injected through the postacute instead of cannulating the vein?
We will normally try not to inject through the chemo pods and so on. The reason being is that sometimes we actually contaminate the chemo pods, so we try to avoid that. Yeah, we can actually see the radio tracer along the chemo pod area, so which is not what we want during imaging. Yeah, if we cannot avoid, then we have to use it, but preferably we will try to avoid it.
So, uh, I know that, like for example, X-rays and things like that. So pregnant women cannot undergo X-rays for safety of the child inside. So, is nuclear medicine safe for pregnant women and elderly people?
Okay, we can actually use them for babies. Uh, in we can actually use for babies as young as 6 weeks old, okay, until old elderly people, we are still using it. And for pregnant women, the time I did show you a picture of the lung perfusion scan. That one you can actually use for patients with embolism, because the radiation that we give is actually much lower than the conventional using the CT and so on. So although it's a gold standard, CT is now the gold standard, but in the past we still use pulmonary for lung perfusion imaging for pulmonary embolisms.
Um, there are allergy reactions to certain drugs. Some people have certain allergies. Are there any allergic reactions related to nuclear medicine?
Okay, the amount of radioactive that we use, for example, like in radioiodine, some people they say they're allergic to seafood, but the amount of iodine that we give is actually very, very low. So most of the time, the patient do not develop any side effects. So when patients say they have side effects after treatment, yes, I will agree that some patients actually they have transients. For example, they have the loss of taste. They feel that their appetite is lower after treatment. Yes, it occurs, but then probably will go off, depending again whether it's for scanning or for treatment and so on. But this normally occurs more for those people undergoing treatment.
Okay, let's see if there are any more questions from the audience. Looks like any more, because we're coming to close to an hour already. So let's see if there are any more. If not, all right. Okay, so it's like we have to wrap things up. Before we have Dr. Alex answer one last question for us tonight, scan this QR code, okay, to fill out the questionnaire and share this Facebook post. Make sure you make it public, because I see a lot of shares, but then I don't see a lot of names. So if we can't see your name, we won't be able to select you as the winner. So share this Facebook post, scan this QR code, fill out the questionnaire, and you stand to a chance of winning a Penang Adventist Hospital woven bag, Penang Adventist Hospital umbrella, an Adventist Bakery voucher, and also a Tekno Penang entrance ticket. Tekno Penang's entrance ticket is valid until the end of the year, so you do not need to worry. Hopefully by then, with the vaccine and things like that, things will get better. Okay, looks like before we give you your last question, there's one question from the audience. Let's have that question from the audience. Okay, thank you. What are the road to specialization to nuclear medicine? Someone, probably a student.
Okay, there's various pathways. In Malaysia, there's a direct pathway to nuclear medicine. Some people will they have they specialize in internal medicine before they actually branch into nuclear medicine. Some do radiology first before they branch into nuclear medicine. So depending on which area you are from, most of us eventually will just do nuclear medicine. There'll be it's considered a subspecialized degree, subspecialized field, whereby in radiology they actually can sub into nuclear medicine, or internal medicine sub into nuclear medicine. Internal medicine, which is general physician, they can sub into nuclear medicine, or you can direct, like in Malaysia, we have a direct program into nuclear medicine. Yeah. Okay.
Good. Dr. Alex, do you have any message to our audience in conjunction with World Cancer Day before we end our show?
Well, get yourself checked early. Do not wait. Time and tide waits for no man. So in this COVID pandemic time, everyone is very afraid to get themselves checked. They'll say wait until the pandemic is over. But by waiting, you actually delay yourself from getting treatment. So if you have something that you need to get it checked, please get it checked out rather than waiting. So the advice for most people is the DJ did say, do not go to hospital unnecessary. But if you think you have something that you need to be checked, please do. Do not wait until the time when you advanced case, then you come over, then it's a bit more difficult for everyone to treat. Yeah.
Thank you so much, Dr. Alex, for spending your time with us in the past hour. Thank you for your sharing, and hope you and everyone at Penang Adventist Hospital stay safe and healthy always.
Thank you. Good night. Thank you, everyone. Good night.
That's all we have for tonight. Thank you for being with us since 8 p.m. We'd like to thank Greatech for sponsoring this episode of Science Stream. See you again next month. Good night and stay safe.